So kidney stones are mineral deposits which collect anywhere in the urinary system really, but primarily they start in the kidneys. There are a multitude of causes. The main number one cause is dehydration, so we always advise patients keep yourself well hydrated in order to reduce your risk of incidence of kidney stones. But they can also be caused by metabolic factors, recurrent infections, and diet. Interestingly, they're 2 to 3 times more common in men than women. Kidney stones classically present with pain, actually, and that's usually when the kidney stone has travelled from the kidney into the drainage pipe, which is a lot narrower space, causing blockage, which is what causes the pain and discomfort, which can also be associated with fever and sometimes blood in the urine. In that situation, it's really important that you seek medical attention straight away. However, for the most part, if the kidney stones remain up in the kidney, then you may not get any symptoms at all. So how do we diagnose kidney stones? Well, sometimes traces of blood are picked up in the urine on testing, which leads to further investigations from your GP. And certainly if you come and see somebody like myself, the gold standard test would be a CT scan. And this is an X-ray scan which looks particularly for any areas of calcium in your urinary tract. And that's the gold standard way to diagnose kidney stones. What we do with it all depends on the size and location of the stones. If you have small stones in the kidneys, these can generally be left alone. And by small, we're talking about anywhere from 1 to 3 millimeters. However, if your stones are bigger, for example 4 millimeters and above, we tend to want to treat these, and the reason being is because if they do drop into your drainage pipe, they're going to cause you pain and discomfort and can make you feel rather unwell. Treatment of the kidney stones can be either through shockwave treatment or an operation called a ureteroscopy, where we pass a very flexible fine camera in through the water pipe down below, up into your kidney, and laser it to dust. And occasionally we can even grab it out with a basket. Of course, that requires a full general anaesthetic, but it's generally very safe and only takes about 45 minutes. Shockwave treatment, of course, avoids general anaesthetic altogether, which is a good thing. However, if your stone's very hard, we always advise that some patients may require more than one treatment session for it. So overall, in terms of reducing your risk of getting kidney stones, hydration is the key. If you eat high quantities of salt, red meat, or foods high in oxalate, it's always best to go in moderation. But just remember, keep yourself well hydrated.